Hello and welcome to the first Indiana Balance of State Continuum of Care session at the 2025 Indiana Housing Conference. My name is Daniela Jordan Gonzalez, and along with Abe Roll and Abigail Kornberger, we will be presenting our session titled State of Homelessness in Indiana. This session is a partnership between the Indianapolis Continuum of Care, the Indiana Balance of State Continuum of Care, the Coalition for Homeless Intervention and Prevention, CHIP, and the Indiana Housing and Community Development Authority, IHCDA. This presentation aims to provide a picture of what homelessness looks like in our state so we can think of ways to help address the housing crisis in our communities. This is the first time that CHIP and IHCDA collaborate to create a presentation on what homelessness looks like in our Hoosier state. IHCDA as well as CHIP are two organizations that seek to improve the lives of Hoosiers by providing affordable housing options as well as addressing immediate needs for shelter and housing. Both organizations serve as the Homeless Management Information System, or HMIS, lead in their continuums of care. The Indianapolis CoC covers Marion County, whereas the Indiana Balance of State covers all other 91 counties in Indiana. Serving as an HMIS lead means that they ensure that the system works properly for agencies that use it to track their intakes and submit reports to the Department of Housing and Urban Development. IHCDA and CHIP also serve as a coordinated entry lead for their continuums of care, thus working with CE leads agencies, ensuring the prioritization list prioritizes people who are most vulnerable for housing. Finally, IHCDA serves as the collaborative applicant for their CoC, meaning that they apply for funding to HUD on behalf of the agencies in their continuum of care, and CHIP helps with project management in their CoC. Now I will let Abe and Abigail present themselves.
Great. Thanks, Daniela. Good morning, everyone. My name is Abe Roll. I am the HMIS data narrator for the Coalition for Homelessness Intervention and Prevention. I've been at CHIP for just a little over 2.5 years. A little bit about myself as a human. I love, as you can imagine from my title, a good dashboard or a newsletter, so I'm often playing around in Tableau. With that, that means that I've not really taken a lot of time to get to know how to cook, but that doesn't mean that I now know all of the restaurants if you ever need a recommendation. Abigail?
Thank you. My name is Abigail Kronberger, and I have been on the HMIS team here at the IHCDA for about a year. Prior to this role, I was at the IHCDA under a different position. So in total, I've been here for about 2 years. I do have a passion for the intersection of health and homelessness, and that's where my background is. Now, when I'm not looking at spreadsheets, I am reading. Love to read fantasy books. As of this year, I've read about 7,000 pages.
Thank you, Abe and Abigail. I am Daniela Jordan Gonzalez, and I am a mom to a toddler, a cat, and a dog. I have been with IHCDA for 6 years in the HMIS data analyst position. And when I am not thinking about numbers and data analysis, I love spending time using my hands to do watercolor and make all sorts of fun little projects. So now that you know a little bit about us and our collaboration, let's look at the agenda. So in today's presentation, we will cover the following topics. First, I will explain important definitions that will help you understand who is and is not counted as part of the point-in-time count. Then Abe will walk us through what the point-in-time is, and he will share an important reminder to keep in mind throughout the presentation. I will then share the point-in-time count analysis for our state, followed by the housing inventory chart analysis for our state by Abigail. Subsequently, Abigail and Abe will team task sharing what is beyond the pit and the hick, as well as provide more context about what these analyses mean. And finally, Abe will wrap us up sharing resources and ways in which you all can get involved in helping address the housing crisis in your communities. So before we start talking about the state of homelessness, let's talk about the sources we use to paint a picture of homelessness in our state. The 3 main source groups we use are the following. The HMIS, or Homeless Management Information System. This is a system that all HUD-funded projects must use to do intakes for their clients. The HMIS stores data about how the people they serve move through the homeless response system in the state. The Domestic Violence Client Track or comparable data system is like HMIS with the exception that DV Client Track is a closed system, meaning that people outside of the organization that generates a record do not have access to that record. Finally, there are 4 federal reports submitted to Congress as part of the AHAR, or the Annual Homeless Assessment Report. These reports are the Housing Inventory Count, or HIC, that tracks the number of projects and beds to serve people experiencing homelessness. The point-in-time count, or PIT, that tracks the number of people experiencing homelessness in one point in time during the year. The Longitudinal System Analysis, or LSA, tracks how long households remain homeless, the percentage of households that return to homelessness after a period, and the percentage of people exiting to permanent destinations. And the System Performance Measures, or SPM, that evaluates how the homeless response system performs in serving individuals experiencing homelessness based on 7 measures, including the number of first-time homeless, the number of sheltered homelessness, and the length of time a person remains homeless. We also use census data as well as other resources that will be mentioned later in the presentation to give context to our data. Like the broad examples of what comes to mind when we talk about housing insecurity, there are many definitions of what homelessness can look like. There is informal homelessness, like when someone is couch surfing or doubled up, or staying with another friend or family, in a hotel motel while between permanent housing options or other unique circumstances. The Department of Housing and Urban Development maintains 4 categories of homelessness. These can include literal homelessness, meaning staying somewhere not meant for human habitation or in a shelter, or being at imminent risk of homelessness, which means that the person can be reasonably assumed to be homeless in the next 14 days and lacking resources to obtain new housing. Category 3 means homeless under other federal statutes, such as the McKinney-Vento definition, where someone who meets another federal homeless definition may qualify as homeless under this category. In Indiana, this largely refers to runaway and homeless youth under the age of 25. Importantly, the final category of HUD's definition of homelessness is for individuals fleeing domestic violence, including those considering or attempting to flee. So, who is and is not included in the point-in-time count? People who are included in the PIT must be literally homeless per HUD's Category 1 definition. This includes people sleeping in crisis shelters and long-term shelters, as well as places not meant for human habitation on the night of the count. On the other hand, people who were couch surfing, hospital stays, or incarceration, people in doubled-up situations, student homelessness, DV survivors not staying in shelters, people in housing projects such as permanent supportive housing or rapid rehousing or recovery housing, and people who decline to participate in the count are excluded from the count. Now that you know where the data comes from and who is and is not included in the point-in-time count, I will pass it on to Abe to talk more about what the PIT count is. Abe?
Great, thank you, Daniela. So with that context of kind of who is included in the point-in-time count, we want to make sure that we also talk about how we get the data in the count and why it's collected. So at a very high level, the point-in-time or PIT count is a federally mandated census of everyone in a community who is experiencing homelessness on a single night. And any community who receives federal continuum of care grants for their homeless response system is required to do a PIT count in the last 10 days of January. And this is a requirement that's tied to that federal funding because all of the data that gets collected is included in, as Danielle mentioned, the annual homeless assessment report, which is actually presented to Congress to help inform housing and homelessness policy. So in Indiana, we actually have 2 PIT counts. The Indianapolis-Marion County PIT count took place in January 22nd of this year, and the Balances State, which encompasses the other 91 counties outside of Marion County, took place on the 29th. And based on county participation, as a state, we had about 94% of the Hoosier population represented between the 2 PITs this year. And the data between these PIC counts comes really from two sources. It is either submitted electronically through the response systems database, and then it's also gathered via surveys. And that's in particular for residents who are sleeping outdoors, abandoned buildings, staying in their cars, or otherwise unsheltered. And that survey piece in particular is really a huge collaborative effort across the state to get all of this data and to fill out all these surveys. We had almost 600 volunteers throughout the state for our 2 point-in-time counts and over 220 unique organizations that were involved in making sure that we were able to get all of the data that we're going to be talking about today. And before we get into the numbers themselves, I also really want to ground us in why we are here and why we do this work every year. These numbers and this data is really important for informing policy, but it's not just so that we have numbers and we have charts, but these are actual Hoosiers that we are talking about on all of these slides. They are real sacred human lives, and every number that we present today reflects an actual Hoosier who both needs and is deserving of housing. And that's really why we do this every single year, because we want these PIC counts at 0, and we want every single Hoosier to be housed. So to that end, I kind of want to reemphasize that when we talk about it being a point-in-time count, this isn't a simple, count going out and saying, okay, 1, 2, 3. These are real community efforts to connect with folks who are experiencing homelessness on these nights. And every community is collecting the same essential information that we use for the reporting, but each community is able to do it a little bit differently. Some will use it as a time to connect folks to services like medical or mental health care. Some use it to work on getting folks connected to housing resources. And across all of the different communities, we meet a lot of people and we hear a lot of stories. And some of these stories really do our hearts good. In last year's point-in-time count, we had a team here in Indy who actually met a young teen who had run away from home because it was a really unsafe situation. They were able to work with this teen, and they actually got them connected to care, got them connected to youth services. And ultimately, they reunified them with some grandparents and got them into a safe housing situation. So that teen was actually not included in any of the numbers because of the year of, or because of the work that team did that year. Other stories that we hear aren't always quite as uplifting. In this January's count here in Indy, we had a team who went out and they were surveying, and they met a man who had not been admitted to the hospital, but he was sleeping in the lobby just because he needed a warm place to stay. And they worked and they tried to get him connected to shelters, to the city warming centers, but every single bed that he was eligible for was completely full. They had to drop this man back off at the hospital on a cold Indiana January night because there was literally nowhere else for him to go. And telling those two stories really in the hopes that as we talk about the numbers and the trends, that we really hold on to the truth that every single person has their own story, and that these stories can and should inform how we address homelessness and housing policy. And with that, I will turn it over to Daniela, and we will start talking about the numbers.
Thank you, Abe. So on one point in time in January 2025, there were at least 6,675 people experiencing homelessness in Indiana. Of those, at least 5,143 individuals were sleeping in sheltered locations, and at least 1,532 individuals were sleeping in unsheltered locations, or in other words, called places not meant for human habitation. These individuals are not necessarily the same people year over year. Many of them are first-time homeless or chronically homeless individuals. People experiencing homelessness are families with young children, youth, people with disabilities, young and middle-aged adults, single mothers, fathers, and elderly people. And just like Abe mentioned, the numbers that are presented today represent those human lives. The number of people experiencing homelessness in Indiana has been on the rise for the last few years, with state numbers increasing by 19.1% between 2019 and 2025. Although the Indiana Balance of State saw a higher percentage change in the number of people experiencing homelessness between 2019 and 2025, They saw the smallest increase in their numbers between 2024 and 2025 at 5.5% compared to the state and to the Indianapolis Continuum of Care at 5.9% and 6.7% respectively. Smaller percentage changes between 2024 and 2025 suggest more comprehensive and accurate counts. Despite numbers rising in Marion County, it is worth looking at rural counties since they represent 54 out of 92 counties in the state. To identify rural versus semi-urban versus urban counties, we used a metric called Index of Relative Rurality. What we found is that even though the numbers of people experiencing homelessness in rural counties are small compared to semi-urban and urban counties, they saw an increase of 16.6% in their PIT count between 2023 and 2025, compared to an increase of 9.4% for urban counties during the same time frame. Another way to look at the point-in-time count is to differentiate between people who were sleeping in shelters versus people who were sleeping in unsheltered locations on the night of the count. So between 2023 and 2025, the sheltered count increased by 5.9%, whereas the unsheltered count increased by 31.9%. This means that between 2023 and 2025, there were almost 6 more people for every 100 people sleeping in sheltered locations, and there were almost 32 more people for every 100 people sleeping in unsheltered locations. However, it is important to notice that between 2024 and 2025, the sheltered count increased at a higher rate than the unsheltered count at 6.9 and 2.3 respectively. To understand why the unsheltered count increased by 29% between 2023 and 2024 and by only 2.3% between 2024 and 2025, we need to provide some context. In 2023, more people were losing shelter due to ESGCV or Emergency Solutions Grant COVID-funded shelters closing, rental assistance programs ending, and more people feeling more comfortable being volunteers on the night of the count, which could explain the big jump. The slight increase in the number of unsheltered individuals between 2024 and 2025 could suggest that increased efforts in outreach and awareness are making it possible to have a more accurate picture of what unsheltered homelessness really looks like in our state. Talking about the unsheltered count is an important topic, but it is key to understand that there are many reasons why someone might not enter a shelter, project, or program. Some of those reasons could be that a program may serve a specific population and might require a household to split between different projects or agencies. Maybe a geographical barrier or lack of transportation can impact an individual's decision to go into a shelter. Also, sometimes someone remains in an unsheltered location due to difficulty finding a program or bed that allows their pet to reside with them. Certain programs can also or shelters might have higher barrier enrollment requirements, which make it difficult for some people to access shelter. Or it could simply be a matter of personal choice, or that the shelter project or program is not the right fit for the individuals. The three main takeaways from our PIT analysis this year were that the number of people experiencing homelessness reached a new high in 2025 with at least 6,675 people counted in Indiana. Also, more than half of the states in Indiana are rural. Rural counties saw an increase of 16.6% in their homeless count between 2023 and 2025, higher than non-rural counties. More outreach and awareness are helping paint a more accurate view of unsheltered homelessness throughout the state. These are just some of the takeaways that we took from this year's analysis. And now, before I pass it to Abe, I want to talk about the breakdown of the PIT count by the number of individuals in each household type. These three household types are families with children under 18, families without children, meaning adult-only households, and families with only children, where everyone in the household is under 18. so this could be parenting youth. What I want to emphasize here is that the point-in-time count fails to capture unstably housed youth, couch surfers, or youth in doubled-up situations. Though the numbers of only children household are very small compared to the other two household types, it is worth clarifying that youth homelessness is a significant issue in Indiana and needs to be addressed by partnering with schools, runaway homeless youth programs, and any other resources that tackles this issue. I will now pass it on to Abe.
Thank you, Daniela. So now that we've talked a little bit about where folks are showing up in shelters or unsheltered, I want to make sure that we also talk about who is showing up. And so when we're talking about the over 6,000 Hoosiers who are experiencing homelessness on this night, who really are we talking about? And so to start, when we look at gender data and compare it to the Indiana census data, we do see that there is some overrepresentation in the homeless response system. So on the night of our point-in-time counts, about 58% of the individuals who were in our homeless response system were men and boys, compared to about 50% of the overall population of Indiana being men and boys. A couple things to note here is that you can see on the left-hand side that 1% of the individuals in our response system on the night of the pit reported a gender diverse identity other than male or female, and that is not something that the annual census captures. And so that's kind of where you're seeing a little distinction between those two populations there. Also want to talk a little bit about the age of folks who are showing up on the night of the pit. So on the left, you can see the age breakdowns for the point-in-time count compared to the visual on the right, which is the overall Indiana census. And you can see at the bottom of each of these visualizations in that light blue, the biggest overrepresentation here is for Hoosiers between the age of 35 and 44. About 12% of all of the folks living in the state are between that age of 35 and 44, but 22.1% of the folks experiencing homelessness on the night of the pit were in that age group. You can also see some slight overrepresentation for the ages 25 to 34, or between the ages of 45 and 64. One thing that I do want to reiterate here is that when you look at these visuals, it appears that there is underrepresentation for youth and for young adults who are age 24 and below. But as Daniela mentioned, that is likely due to the nature of how young people show up in the homeless response system. As a population, youth and young adults are very transient. They might be on a couch one day, in a shelter the next day, outdoors the next. And so that transiency doesn't really lend itself to a single night snapshot quite as readily. So just want to be clear about that distinction there. And then when we look at the demographics of race and ethnicity, it is also very important to note that Hoosiers of color and particularly Black Hoosiers are overrepresented on the night of the count. So as you can see on the visual on the right-hand side, about 6% of the folks living in Indiana are Black, but almost a third of the individuals in our homeless response system on the night of the count were Black. And so that's really where we do see some of the most stark overrepresentation is particularly for Black Hoosiers on the night of the count. Another population that the point-in-time count looks at is folks who are experiencing what we call chronic homelessness. And these are folks who are experiencing long-term homelessness of at least a year and also have some kind of disabling condition. So, for example, they might have a chronic health condition such as cancer, diabetes, physical disability. But again, it is long-term homelessness with some kind of disabling condition. And as you can see in the visual here, between 2024 and 2025, there was an increase in this chronic homelessness across the state. So that means that both Indianapolis and the balance of state, we are seeing more people who are experiencing homelessness long-term, who have additional conditions that make it difficult to get or stay in a shelter or housing. And so that's something that we have to be mindful of as we're continuing to work to bring folks home. It is not all sad news, though. In particular, Indiana has done a really excellent job at reducing homelessness for Hoosier veterans. So, nationally, over the last few years, homelessness has been on the rise, but here in Indiana, we are seeing a pretty strong reduction in veteran homelessness since the COVID pandemic. The balance of state has seen a 29% reduction in veterans experiencing homelessness. Indianapolis has seen a 54% reduction. And the reductions that we're seeing here in Indiana are really due to the fact that our veteran service providers do exemplary work. And because they do such good work, it makes them even more competitive for targeted veteran funding. And that helps them to continue to scale and to sustain all of the excellent work that they're doing throughout the state. And that's something that we really need to keep in mind as we're advocating and engaging with policymakers, that when folks are doing excellent work, and when there is funding that gets them to sustain and scale that work, we really see results. And that funding is paying off. And when we look at our veteran service providers, this is what fully funding a program looks like here in Indiana. And with that, I'm going to turn it over to Abigail to talk about the housing resources. Abigail?
Thank you, Abe. Now, before we jump into the 2025 housing inventory chart results, I want to reiterate an important point that Daniela made earlier in the presentation. There are many reasons why someone may not enter a shelter, program, or project like the ones we're going to discuss today. Now, that project may serve a specific population or require a household to split between different projects or agencies. There may be a geographical barrier or lack of transportation. Sometimes someone remains in an unsheltered location due to difficulty finding a program or a bed that allows their pet to reside with them. Certain programs or shelters may have high barrier enrollment requirements. Persons with chronic health conditions or individualized medical needs may wish to avoid congregate living settings. Or it could be simply a matter of personal choice, or that the shelter, project, or program is not the right fit for them. This is a snapshot of the 2025 housing inventory chart results for the state of Indiana. We can see that there were 13,850 total beds. Now, about 12,976 of these beds being available throughout the entire year. 195 organizations and 366 projects were included in the HIC this year. 284, or about 78%, were HMIS or DV comparable database participating. 82 projects being those not currently participating in either environment, but were identified as serving individuals experiencing homelessness in your communities. The total shelter count for ES and TH projects was 5,143. We also saw an 82% year-round utilization rate among ES, TH, and PSH projects across the BOS. Looking now at a bed count breakdown across project types. Emergency shelter beds make up the majority of year-round project beds at 5,480 beds. This tells us that the majority of our beds across the state are serving people with immediate shelter needs. Now you may be asking yourself, what is the difference between total and year-round bed count data? The total bed count includes seasonal and overflow bed counts for TH and ES projects. Seasonal beds are only available during the coldest months of the year, typically November through April. Overflow beds are only available if a shelter location is at full capacity. In this year's HIC, 866 beds were identified as a combination of seasonal and overflow beds. This means that a community may be able to meet their capacity need in the month of January, but not have enough beds to meet that same need in June. Now, before we take a look beyond the pit and HIC, I want to highlight the tremendous work that you, our service providers, are doing for our unhoused neighbors. On the night of their respective pit counts, the agencies that make up our Indianapolis Balance of State CoCs met the immediate shelter needs of over 5,000 persons. Without you all there to meet that need, these neighbors may have very well been sleeping in places not meant for human habitation on this night. Now let's transition into a look beyond the pit and the HIC at which programs are housing and keeping Hoosiers housed in our communities. Before we talk about the positive outcomes we are seeing, it is also important that we cover what a permanent housing destination is, as defined by HUD. A permanent housing destination can include any of the situations you see here. A client could be living in a rental or a home they own with or without an ongoing subsidy, have permanent tenure with friends or family, or be living in a permanent supportive housing unit. These will be important to keep in mind as we discuss permanent housing destinations next. Now, with that understanding of permanent destinations, let's take a look at a bit of the data available to us from our LSA. Year after year, we are seeing that a majority of households exiting rapid housing programs are moving to permanent housing destinations. For 2024, we saw this percentage at 90s or 79% and 72% for the Indianapolis BOS CoC and Indianapolis CoC respectively. Additionally, the Indianapolis CoC has seen an over 90% stability rate among rapid rehousing clients who have exited to permanent housing destinations over the last 5 years. Clients who are housed through rapid rehousing programs are staying housed. This data is available to us through our SPMs. For clients that have moved into permanent housing, we are seeing that they are staying in their permanent housing unit or are exiting to other permanent destinations. From 2021, we've seen this percentage rate be over 90% for both the ND CoC and BOS CoCs. This trend tells us that clients who have moved into permanent housing are staying housed. As we've discussed, permanent supportive housing units make up a portion of the outcomes considered a permanent housing destination. Let's take a look at where we're seeing these beds across the state. We see that Marion, Allen, Lake, and Vanderburgh counties have the greatest number of total PSH beds. We can also see that there are a number of counties and communities across our state that have few or no PSH beds. Although we are seeing overwhelmingly positive outcomes associated with these rapid rehousing and PSH programs, we see that our overall inventory of beds for these projects year to year remains stagnant. As we see an increase in individuals experiencing homelessness, limited program capacities may very well inhibit the ability of these programs to scale to meet the current need in their communities. Furthermore, if we look at the data available to us from the United Census Bureau, we are seeing an overall decrease in the availability of total vacant, for rent, and for sale units in the state of Indiana. From 2019 to 2023, we have seen a decrease of 17% in for rent and 28% in for sale units. With a decrease in the availability of rental units, it's important to acknowledge that the 50,000 units we see represented in 2023 are not all affordable units. I will now pass the presentation over to Abe.
Thanks, Abigail. So as was just mentioned, we are seeing as homelessness is continuing to increase, we have fewer beds that are available for rent or sale here in Indiana. And we're also seeing that as that availability of housing is decreasing, it is simultaneously becoming more and more expensive for Hoosiers to stay housed. So if you take a look at the visual on the left, you'll see that since COVID, or since 2010, over the last decade or so, monthly housing costs for homeowners has gone up about 17%, and monthly housing cost for Hoosier renters has gone up by 53%. If you take a look at the table on the right, this is kind of showing you what wage you would need if you were wanting to rent here in Indiana. So the first column, this is showing the number of bedrooms in a particular rental unit in Indiana. The column in the middle, that is the number of hours that you would have to work at minimum wage to be able to cover your rent and not spend more than 30% of your income on housing. The column on the far right is what's known as the housing wage, and that is how much you would need ultimately to make per hour to be able to afford that particular unit. And so really zoning in on that middle column there, if you are a single parent in the homeless response system, one of the refrains that you might hear a lot is, why do they not just get a job? But if you take a look there at that middle column, if you are a single parent with 2 kids and you need a 3-bedroom apartment for everyone to have a roof over their head, there is quite literally not enough hours in the week for you to work at minimum wage to be able to actually afford that apartment. And as the housing costs are continuing to rise and as the availability of housing is continuing to go down, one thing that is pretty consistent is the number of Indiana households that are honestly just struggling to get by. And so the visual here is showing you two different things. The numbers that you see over the orange bars, those are the percent of Indiana households that are living in poverty. And the lines or the numbers in the blue lines there are the percent of folks who are not in poverty, but are known as ALICE household, which means asset limited, income constrained, and employed. And so the blue numbers here ultimately mean that households are employed, but they're still not able to cover the cost of living for where they live. And so year after year, consistently, about 40% of Hoosiers are in these two groups, which means that 40% of Hoosiers consistently are struggling to be able to cover the cost of living wherever they're at in Indiana. And so when we see these point in time numbers, it really can't be a surprise. Housing inventory is going down, housing costs are going up, and consistently, 4 out of 10 Hoosiers aren't able to cover the cost of their living. And so I want to reiterate that it should not be a surprise when these PIT numbers go up, when this is the data that we're living in our reality. But also want to reiterate that there are programs that are working, programs that are getting people housed and keeping them housed. We just need to see them to be scaled to be able to meet the need. And as you're taking this information and kind of digesting what you're hearing about homelessness and the state of homelessness here in Indiana, we also want to reiterate that there are a number of ways for folks to get involved and to make a difference. If wherever you're at in the state, you can get connected to your local government and your regional planning sessions for the point in time count. You can volunteer for the point in time count, actually meet the folks who are experiencing homelessness, and then make sure you share their stories and share the information that you see today. Again, all of this data is reflecting the real experiences of Hoosiers, and it's important that we use these stories as we're advocating for policy change at the local, state, and federal levels. I also want to call out a few examples of things here in Indianapolis that you can either connect to or maybe model in your own communities. So the first is the Street Reach Indy program. That is a unique program here in Indianapolis that helps case managers get cash directly to folks experiencing homelessness. And it's really a cool program in that it enables us to eliminate some of the barriers that may seem really small, but can be huge barriers in terms of getting housing. So it can cover the cost to get vital documentation, like a social security card or birth certificate. It can cover the application fee for a new apartment. But again, it is community sourced and goes directly to individuals experiencing homelessness. You can also see in the middle an example of CHIP's Handbook of Help. This is a comprehensive resources for anyone who is experiencing homelessness or at risk of homelessness. So it includes, of course, shelters and crisis areas, but also things like mental health services, substance use services, services focused for veterans, for youth. And again, that is available online in multiple languages or as a physical handout that you can carry with you. And then another really exciting initiative I just want to plug here is the Streets to Home Indy initiative. This is a new initiative that CHIP is overseeing that is doing just that. It is helping get folks who are actively living outdoors into a home. We are currently in the second phase of our pilot right now. We successfully housed almost an entire encampment, and we're able to get folks home. And we're in the process of housing folks directly again from the streets in our second encampment right now. And so, again, just some ideas for you all if you're looking for ways to get involved. And as Daniela stated, we have used several acronyms in today's presentation. So if you need a reference, we've included the list of acronyms here and everything that they stand for your reference. But with that, we want to really thank you all for taking the time to join us today and to learn more about the state of homelessness here in Indiana. If you have any questions, feel free to email us. The emails for both IHCDA and my work email are here on the slide. We are happy to connect with anyone for any questions or follow-up that you may have after this presentation. But thank you all very much again for joining us today.